Welcome. This is Bill Pierce from APCO Worldwide, and welcome to everybody for the Brazda Breakfast, the afternoon edition. It's been quite a year, but I think we're ending it with an impressive and incredibly important panel. And I want to thank that panel for coming together so quickly. I also want to thank our partners, the Alliance for Health Policy. We're proud to be a sponsor of the Brazda Breakfast, and we are looking forward to another year of briefings next year, and perhaps at some point, we'll all be back together again. Thank you, and again, welcome. Kate, turn it over to you.
Thank you, Bill, and a big thank you to the rest of your team at APCO Worldwide for making this series possible. Good afternoon, everybody. It's a pleasure to be back with our reporter audience. I am Kate Sullivan-Hare, Vice President of Policy and Communications at the Alliance for Health Policy. If this is your first time at an Alliance reporter briefing, welcome. We are a nonpartisan resource for the policy community and dedicated to advancing knowledge and understanding of health policy issues. The speakers are going to open with a few minutes of opening remarks, and then they will take your questions. When we get to the Q&A portion, please press the hand raise button at the bottom of your GoToWebinar window to signal that you have a question. You will then be placed in a queue. When it is time to ask your question, my team will let you know and unmute you. Please state your name and the organization you work for before asking your question. We want to make sure that all of you have a chance to ask at least one question, and we will do our best to get through as many follow-ups as possible as well. Please check out our website for other COVID-19 related resources and experts. We will be sending a one-pager on vaccine deployment specific materials in our follow-up to you. On December 11th, the FDA approved an emergency use authorization for Pfizer vaccine, and thus commenced the process of vaccinating millions of Americans ages 16 and older, starting with the healthcare workers. Yesterday morning, the first doses of the vaccine were administered to healthcare workers in New York and right here in Washington, D.C. Today, I am pleased to have a panel of experts familiar with protocols and technologies for safe and efficient vaccine deployment and administration across the country. First, I'm pleased to be joined by Claire Hannon, Executive Director of the Association of Immunization Managers. Ms. Hannon has 18 years of experience in children's health and immunization. She's worked on Capitol Hill and has lobbied for children's health issues. She is a former Director of Immunization Policy for the Association of State and Territorial Health Officers, where she worked with other state health officials, the CDC, and other partners to improve and enhance immunization policies and practices. Claire? Claire, we need to have you unmute.
Okay, the double mute. Okay, sorry about that. Thanks so much for having me and for doing this really incredible session on the vaccine distribution. I think all of us, at least all of us on the panel, had goosebumps this weekend as things started to get underway. So I'm going to kind of give you the 30,000-foot overview of what's happening and what states, what the roles that states play. The Association of Immunization Managers is a nonprofit, and our members work in the state and territorial public health agencies that are doing the distribution planning and helping to map out the distribution. So there has been a planning process underway for several months. A CDC, Operation Warp Speed, and state health departments have been working on that together. States submitted distribution plans in October. They have signed data use agreements. They have met a series of deadlines leading up to when vaccine would be available. And now what's happening is that states are receiving allocations of the vaccine. So as the vaccine becomes ready to ship from the Pfizer facility, that vaccine is spread across states in a pro rata allocation process. And then the states have the ability to look at their allocation and determine where the vaccine should be sent. So by virtue of where they're sending it right now is sort of where they're prioritizing. And most, with their initial Pfizer application, sending that vaccine to hospitals where they can vaccinate healthcare workers. So I'm going to talk a little bit about the approach that states are taking and how it works. So states are enrolling private providers. They have a provider enrollment process where the providers agree to give the vaccine, they agree to not charge for it, they agree to store it properly, they agree to report the dose administered. They complete the paperwork, the state approves those providers, and we're working to set up a system across the country with tens of thousands of providers enrolled. The focus for phase 1A has been enrolling those providers that serve healthcare workers. So that's really been the target, but we are looking out until further on when there's larger supply that we want to have the vaccine available in as many sites as possible. So enrolling as many providers as possible, physicians, independent pharmacies, federally qualified health centers, local health departments, community health centers, any provider that we can get. So that's what's happening at the state level. There is also a federal pharmacy program, and there's two pieces to that. The federal government is enrolling pharmacies that have, national presence rather than having those pharmacies enroll in every single state. So that is ongoing, as well as this pharmacy partnership with CVS and Walgreens and a few other pharmacies to vaccinate in long-term care facilities. I think we'll have some discussion about that later. So just to mention a few things about how states are doing this and how they're deciding who to vaccinate first. There is guidance coming from the Advisory Committee on Immunization Practices, CDC's Advisory Committee, around who to prioritize. And it is a phased rollout, with phase 1A being healthcare workers and long-term care facilities. So that's what's going on now. Phase 1B and phase 1C have not been clearly articulated by ACIP, but there have been discussions. And in those discussions, phase 1B includes essential workers, and phase 1C includes those over 65 and those with underlying conditions. So states are really looking at how to get vaccine to those priority groups moving forward. They will receive weekly allocations. In the event that the Moderna vaccine is authorized, as we anticipate this weekend, they will be having Moderna vaccine shipped out in the next week. And then as we move forward, weekly allocations, sending to those providers who have enrolled, those providers reporting their inventory and reporting doses administered. And hopefully as we get more and more doses, we're expanding the providers who receive those doses. We're expanding those who are prioritized to receive the doses. One more comment I wanted to make is that many states, most states, all states have in some way a plan for allocation, a strategy, an equity strategy, an advisory committee, an ethics advisor, a way to enroll and engage communities, community-based organizations, and get feedback from them. They also have very robust communication plans they have submitted. We're hoping that they do get funded additional resources, state and local governments, for vaccine distribution to roll out this communication, to really make robust information available, and also engaging with these advisory committees to assure equity in the distribution. So I'll stop there and look forward to your questions.
Great, thank you so much, Claire. Next we have Jay McHargue. He's Chief Executive Officer of AeroSafe Global. Mr. McHargue has 20 years of experience in engineering, operations, and strategy. He has focused his business and engineering experience on the cold chain industry, leading innovative product development and packaging solutions, including those that will house COVID-19 vaccines on their journey to local administration sites. Jay?
Thank you. It's a real pleasure to be here, an exciting panel, and really excited to be a part of this this huge effort. I have a couple of slides I'd like to show and demonstrate a little bit more detail around how some of these vaccines are being shipped. So next slide, please. So they don't have a strategy on how to deliver COVID-19 vaccines to the space station yet, but I do know that it will be in our box if it happens. I just need an excuse to put this slide up because I think it's pretty cool, and that's our box on the left corner. But most of our customers are in fact biopharmaceutical companies delivering all different temperatures to all different parts of the world. Next slide, please. So the overview is vaccine distribution for Pfizer and Moderna, mostly Pfizer because Moderna is being taken care of primarily by McKesson. So I find it interesting on how Pfizer has decided to do this. There's really 3 stages: the primary distribution to larger hospital systems, pharmacy depots and states; the secondary distribution to come soon, where smaller doses are being, smaller amounts of doses are being shipped from those facilities and directly from pharma production to smaller offices, more remote doctors' offices, and smaller pharmacies. And then finally, the last mile, which is actually carried on a daily trip to long-term care facilities. So I'll dive into each one of these with the next slide. So we can start with the primary vaccine distribution for Pfizer. If you're not aware, they're both distribution sites are in the northern states, Michigan and Wisconsin, and they're being distributed to hundreds, thousands actually of locations of pharmacies and hospitals across the country. Next slide, please. And they're being delivered in a larger container that can hold approximately 1,000 to 5,000 doses. This container is designed for 10 days under dry ice to keep the vaccine at approximately -70. And there is after the solution's been used, there's a box recovery system supported by Pfizer that brings them back for refurbishment and then back to the pharma production. That's important because for every 10,000 boxes you produce, you can support about 100,000 shipments a year with this recovery system. And with the amount of vaccines that will be distributed, that's an important piece of the supply chain. In addition to that, there needs to be in place a dry ice replenishment program. So these large containers can be re-iced every 5 days, 3 times to last for 20 days. So a system's been put in place to deliver ice to these pharmacies and hospital systems. And most people are choosing to do this approximately twice a week to ensure that they never meet the maximum 5 days. And the box will approximately 25 pounds every 5 days of ice. Next slide, please. Containers like this are an example of what can be used, and you can see dry ice is surrounding the product, and there needs to be some sort of dry ice tray to remove, to reach down into the payload space to have access to the vaccines. All of these are equipped with real-time visibility, temperature, light, location, and again, as mentioned before, the reusability of these solutions ensure the availability of them for global distribution. Next slide. So the secondary distribution are systems that are built for approximately 5 to 150 doses, again, delivering to smaller sites. These solutions last about 4 days. And that is, the idea is that these smaller facilities will use these up in the week. And as Pfizer's distribution needs to be kept at about -70 during distribution, it can be stored at 2 to 8 for up to 5 days after it arrives. So the smaller solutions directly from pharma and from the larger systems will be in place shortly. And next slide will show, again, dry ice replenishment that needs to happen if we want to keep that solution at the right temperature. And then finally, the vaccine distribution for the last mile. At the hospital systems and pharmacy depots and states, they needed a way to deliver the solution to long-term care facilities. And these are 5 to 500 doses lasting 24 hours. So think of a personal carry case like the one behind me. Again, with dry ice replenishment, these carry cases then carry the vaccine at either 5 degrees Celsius, which is refrigerated, or -20 degrees Celsius, which is frozen for the Moderna vaccine. And on the last slide, I just give an example of some of these carry cases that are being produced today with a schematic of how the thermal plates, which are preconditioned either in a fridge or in a freezer, again at the hospital or depot, to be packed out for the daily milk run, if you will, of vaccine distribution to the long-term care facilities. So I hope I gave you some insight as to the how these vaccines are being delivered. I will say that the entire industry is doing a fantastic job working together, connecting the dots to ensure the safe delivery of these life-saving products. Thank you.
Thank you, Jay. Next, we have Edward J. Coletta, Vice President, Federal Government Relations and U.S. Public Policy for Walgreens Company. Mr. Coletta leads the federal lobbying and public policy activities for Walgreens. Prior to this, Mr. Coletta served as director of the Washington office for Humana, where he was responsible for navigating the company through the historic health reform legislation. Ed?
Thanks, Kate, and thanks for the opportunity to talk with you all today. Walgreens couldn't be more proud of the role that we're fortunate to be able to play now on COVID vaccines. We have been asked to jump into the response to the COVID pandemic going back to the early days of March, when we were asked to help stand up COVID-19 testing centers around the country. Super proud of the effort that we've done there, and all of our team members are signing around the country. To date, we have over 850 COVID-19 testing sites at stores across the country and have completed over 2.3 million tests. I mention that because it's been instructful as we now move forward with the COVID vaccine deployment and administration. And I think what I wanted to share with you today is, in real short order, maybe 3 key pieces that Walgreens believes are helpful to getting to the long-term care facilities, and then in phase 2, the general population. Pharmacists really, they're the core of the front lines of healthcare. Often you will, as a patient, be meeting with your pharmacist a couple times a year, a half dozen times a year, as opposed to meeting with your primary care physician. In addition, because of our footprint, we're located within 5 miles of 80% of the US population. So when you talk about needing to reach the populations, especially those vulnerable populations, medically underserved communities, that's where we believe we can really provide value. In addition, we have the infrastructure necessary to be able to carry this out for the long-term care facilities, and I'll talk a little bit more about that in just a second. Our goal here over the next week is to start servicing roughly 35,000 long-term care facilities. We've been working with Operation Warp Speed, the CDC, and the states over the last several weeks, and probably 6 months in total, to set up the infrastructure and the strategic plan possible in order to then serve those long-term care facilities. So as we were welcomed into the partnership by the CDC and OWS, along with CVS, the long-term care facilities then had the opportunity to choose one of us or to do the vaccinations on their own. And so what you'll see is a breakdown of roughly 40% of the population of LTCs have chosen CVS, 40% have chosen Walgreens, and then the rest are doing it on their own. Beginning probably sometime early next week, we'll begin servicing those long-term care facilities. We'll be going on site to administer the vaccine to both the residents as well as to the workers. And we'll plan then to have these clinics be conducted in 3 different portions. We'll first hit the workers and the residents. We will then wait the necessary 21 to 28 days based on the product for the second dose, and then we'll be going back for a third round to pick up those employees or those residents that we weren't able to conduct the 2 doses on the first 2 times. So we come to this from a position of experience. Walgreens was asked going back almost 15 years ago to help out with the H1N1 situation, and the CDC essentially had said we don't have enough primary care physicians to be able to vaccinate the public in a way that will be meaningful. And so it was at that point that pharmacy, retail pharmacy, grocers, independents, and everybody began to help with the flu shots. We, Walgreens, have actually conducted 150,000 clinics across the country since 2015. And so when there's a lot of discussion about who else can we reach, we point to those clinics and what we've been able to do on flu, as well as other vaccines, for examples of how we can go into medically underserved communities, be them urban or be them rural. I think the last point I would make is on infrastructure, and Jay just touched on this. We've had a great partnership with Jay's company, AeroSafe Global. There's been a great deal of attention, with good reason, on the Pfizer product and our ability to handle it as a pharmacy. So again, we've been planning for several weeks to have the storage ability, ultra cold storage for freezers, as well as the dry ice and capabilities of the containers that Jay walked through earlier, so that when the product is arriving from FedEx to our hubs, we're able to then break up the tray and serve different long-term care facilities in a different area, or as we move forward, potentially also have some of those shots done in store. So again, I'll stop there and look forward to questions.
Great, thank you so much, Ed. Finally, we have Snehal V. Gandhi, Medical Director, Division of Hospital Medicine, and Vice President, Medical Informatics and Care Delivery Innovation at Cooper University. Dr. Gandhi also serves as Assistant Professor of Medicine at the Cooper Medical School of Rowan University. He is board certified in internal medicine, and he will illustrate how hospital workflows, vaccine appointment scheduling pilots, and technologies can leverage to support patient agency in their immunization. Snehal?
Thank you. So thanks for having me today. Really excited to be here today. And as a matter of fact, we're having a fantastic day at Cooper University Healthcare because we administered our first doses of vaccines earlier today, and I was there for the entire time. Of course, to actually get to this point, it was not an easy lift because between the timing of when the vaccines were made available and we knew they were shipping out and they were going to arrive, we had some fluctuations in terms of the dates, but regardless, we had to rapidly develop and deploy an end-to-end workflow so that we could not only start scheduling, but bring in all of our people that were going to receive the vaccines and also start administering in a timely manner without creating mass chaos. And that's what I'm going to focus on for the next couple minutes. One of the first things that came about is that we knew that we were getting Pfizer first, and then there was talk about getting the Moderna vaccines. And so all of the parameters and all the clinical parameters and specifications around that. And so with the Pfizer vaccine, obviously it's 21 days. And when we first heard about the Pfizer vaccine and the first guidance that we received was that it had to be exactly 21 days later. So this posed a challenge in the sense that, well, if it's 21 days later, that's plus or minus 12 hours from the time that you received the second dose. One of the things that I thought about early on, and I walked into the CEO's office here right after I thought of this was, how do we make sure that we don't waste any doses? And the way that I thought about this is that, what we need to do? We need to book both the first dose and the second dose of the vaccine before they even receive the first dose. And this is analogous to booking a round trip ticket on an airline. Most people that book tickets, they book their flight out and then they book their flight back in. And they do it simultaneously. You pick your outgoing flight, you pick your incoming flight. And so we said, okay, that's how we need to do this because this is the workflow that people are familiar with. And this is how we're going to advertise it. This is how we're going to market it. So the next step was, well, what existing technology do we currently have that we can use? And at Cooper, we have the Epic electronic health record system. So we got on the phone with Epic and other people. And most people were saying, listen, we're going to bring the people that are receiving the vaccines, and then we're going to schedule the second dose after they receive the first dose. And I said, no. I want this rule workflow. I want this to work this way because, I think it'll work really well. And I think that we will not waste any doses because everybody will have all of their appointments in hand. And when I told the CEO of Cooper University Healthcare, there's co-CEOs, I told Anthony Mazzarelli here, he was like, no, this is the way to do this. This totally makes sense. And so we worked through the workflows. We used technology that we had on hand, and we made it an entirely pretty much self-service workflow to the point that, we had an interest form, people that were interested in the vaccines. And so they would go to a form, they would put their names in, their information in, and then we cross-matched it with their electronic health record. And then what we did was we sent them email ticklers and patient portal ticklers, and we told them, hey, you can now self-schedule your vaccine, follow this link. So they logged into the patient portal, they were able to select the dates and the times that they wanted to receive the vaccine. Again, exactly 21 days apart. I know there's a grace period now, the 4-day grace period, but at that time when we were building it, we didn't really know about that at that time. So they can go in, they can schedule, they can e-check in, they get a QR code, a barcode. So essentially everything is done before they even come in to receive their vaccine. When they came on site today, and today was the true test to see how this workflow worked, and it worked fantastic. Everybody was very excited, super happy, no issues. So they came in with their barcode. They scanned their barcode. We have greeters and we have people assisting them. They received their vaccine. and then they went into their recovery period where there's a 15-minute waiting period for most people. Some people have 30 minutes. And then they went through that and they were very happy. They walked out with all of the information that they needed. One of the other byproducts of this design, which is a good byproduct that was built into the design, was that the way we formatted our screens in the patient portal was that you would see both of your appointments on the same screen. And the way we worded it, we made it in such a way that if people desired, they could take screenshots of it. So a lot of our staff actually became influencers, whether they knew it or not, because what they wound up doing was that they were so excited about being able to schedule their vaccine at their convenience that they took screenshots and they posted it on social media. So almost immediately, as soon as we started releasing the schedules, what we found was on Facebook, Instagram, Twitter, people were posting, and people that are friends with them, like, hey, this physician, this APP, this person that I know that is in healthcare, they're confident. They're really happy about getting this vaccine. They're super excited. Maybe I should consider the same thing. And so you see all these posts coming through where they're like, hey, when can I sign up? So then we started having people calling the hospital saying from the public, when can I sign up? And we're working through this. Now, the whole design of this thing was meant to be scalable. So obviously we're focusing on our healthcare workers currently, but the design was purpose-built in such a way that when we do move to Group 1B and then we move to the general population and those above the age of 65 with underlying conditions, it's supposed to be scalable. And so what we will do is we will also have self-service functionality for them. So again, a very exciting day for us. We're very happy because, we were able to administer the first set of vaccines today. And more to come. We have a couple hundred people lined up for tomorrow, and over the next couple of days. So thank you.
Great. Thank you so much, Snehal. And if I could have all of our panelists come back on camera, this has been great background for all of our reporters. And what I'd like to remind our audience is that you can click the raise hand button at the bottom of your screen to ask your questions. We ask that you do state your name and affiliation before you ask your question. I will call on you to talk and we will unmute your microphones. But at first I'll start with a few opening questions to our panelists. And particularly, and this might be a question for Claire, but others please jump in as well. How will pharmaceutical companies, pharmacies, and distributors coordinate to get vaccines to local administration sites? All of those components together.
Okay, this is Claire, and so I would say, so you're asking how are the pharmacies coordinating getting the vaccine to sites?
To local administration sites. Is there a grand plan, a map, or how to immunization manage? How will this, what plan will unfold?
So the plan really is to have the vaccine sent to enrolled providers, directly to those sites. I think Jay talked about working with the national CVS and Walgreens program as far as taking vaccine into local, into long-term care facilities. In that case, you're taking the vaccine to the person and vaccinating there, and they're working transport with. But when we get to pharmacies providing vaccines, sort of into the broader population, the vaccine would be sent directly to the administration site, and they would be able to store the vaccine as they're planning to give it. And that has been planned out. So enrolled providers have given their storage information, where the vaccine should be sent, who the patient population they serve, and so that program managers can manage where the vaccine gets sent, to those sites.
Great. Thank you. I do want to turn, we do have some reporters who are ready for questions. Our first reporter is Jackie Lee. If you could please introduce yourself. Do we have Jackie Lee unmuted and ready to ask a question?
Jackie, it looks like you're unmuted, but we can't hear you. So I'm not sure if you.
Okay, I think while we work on Jackie's technical issues, we'll move to Lauren Kelly.
Can you hear me?
Yes.
Great. This is Lauren Kelly with AIS Health's Radar on Medicare Advantage. Thank you so much for doing this today. It really cleared up a lot of things for me. And I have two quick questions for Ed with Walgreens. One is, will you be, when you go to a nursing home facility, will you be vaccinating everyone at once or grouping people to see how they react and then coming back a few weeks later?
Great. Yes, thanks for the question. I hear a little bit of feedback. Great. So we are currently scheduling the long-term care, both residents as well as workers. And I think in light of all of the scientific and clinical data that our clinical team has been evaluating and reading from both the FDA as well as ACIP recommendations, as well as the shots that we're now seeing in real time, we are scheduling groups of long-term residents and workers in as we're able to them administer them starting sometime early next week. So that's the plan that we'll begin to execute on.
Okay. Our next question is from Ellen Milheiser. If Ellen is unmuted and ready to ask her question.
Good afternoon. Can you hear me?
Yes.
Excellent. Thank you all very much for this. This question is for Dr. Gandhi mainly, but maybe Mr. Coletta. Are y'all doing anything to plan on worrying about groups of people being vaccinated and then everybody having a side effect and having to be home for a couple of days and, you know, potentially clearing out the workforce for a clinic?
And I believe that question was for Dr. Gandhi. If you could unmute yourself. I'm going to check. And do we have volume? No.
Looks like Dr. Gandhi is going to have to dial back in order for his audio to work. So maybe we will loop back to that question unless other panelists can help answer.
I would defer to Dr. Gandhi for clinical questions related to that. Yes.
Okay. Great. And was Jackie Lee ever able to find audio?
Hi, can you guys hear me?
I'm
back. I'm sorry.
Oh, great.
My
well,
audio
why don't we go to Dr. Gandhi's question? Great. Why don't we go to
Should I answer
Ellen
the question?
Milheiser's? Yeah, no, go ahead, please.
Yeah, so that is a great question in terms of, you know, if you're vaccinating everybody from the same unit simultaneously or even from the same specialty, you could have potential people after the first dose or the second dose develop symptoms that may be severe enough that, you know, side effects that they may not be able to work. So what we wound up doing is we did take that into consideration, and I can tell you that we spent hours and hours discussing that, and what we did was we staggered our staff. We do look at the schedule, we see where units and what areas that they're scheduling themselves from, and then we did do some staggering there so that we would not have that issue.
Okay, great, thank you. And Jackie Lee, let's return to you for your question.
Okay, great. Thank you guys so much. Apologies for the issues with audio. I was hoping, my question is for Ed. I was hoping he could address some of the confusion around when administrators can vaccinate long-term care facility residents or nursing home residents. Alex Azar mentioned that part of the delay or the confusion was about getting consent from those residents and how it can sometimes take a little bit of time because you have to ask perhaps multiple people for the consent, let's say if they can't consent themselves. Are you guys planning on
like, how are you planning to make sure that that delay doesn't happen going forward? Are there plans in the works to ask for that consent beforehand when you know vaccines are coming, for example?
Yes. So great question, Jackie. And let me answer it in two parts. The first part is that as I think folks are aware, with the rollout of the initial allocation for this week, which is state allocation, and of course is targeted for essential healthcare workers that the states have chosen. The second allocation, then beginning early next week, is focused on long-term care facilities. We've been working with these long-term care facilities for, in some cases, several days. And the issue of the consent forms has actually we've made some progress recently, and that a number of long-term care facilities have said that the consent form can be done orally or electronically. So for those facilities that are allowing that to occur, we're obviously complying with that because it is making it easier. But I would also tell you that as soon as we have engaged the long-term care facilities, we're beginning that process, and they're beginning the process because obviously they're doing it from their end with their residents. So we're hopeful that that's going to clear some things up. I think as we look at the kind of 1 or 2 week timeline of allocation and how things have been rolling out, I think as we expected, and I think the other panelists can probably share that, we knew that once the vaccine would be available, there would be a really big push to then speed up where things are going and how quickly vaccines can be administered. What we would tell you is that we've been working for several weeks and months with Operation Warp Speed, CDC, and the states on their specific plans so that there is a cadence as well as a very kind of detailed execution plan in order to do this in as safe a way as possible. And that's what we're going to be working on and continue to then and begin to start doing with the long-term care facilities here in the next several days.
Great, thank you. Our next question will be from Joyce Frieden. If Joyce could be ready and identify your affiliation. If we have Joyce. I don't know if I think we may have lost Joyce at this moment.
Hello, hear me?
Oh, great. Yes, we can hear you. Thank you.
Sorry, I didn't know I had to unmute. My question is, I'm Joyce Frieden with MedPage Today. I wanted to ask Dr. Gandhi, I heard a healthcare worker who said that her hospital was concerned that after people got the vaccine, healthcare workers got the vaccine, that some of the side effects from getting the vaccine, low-grade fever, muscle aches, are similar to early COVID symptoms. And so I wondered if you guys had thought about that and how you're going to handle it.
So we did think about that, and from a multifactorial perspective, right? So the timing of the vaccine, we do know, what was published out in terms of what the different side effects are, what the side effect profile is, and so we are aware of that. One of the discussions that we had frequently was about, how do we schedule our people in such a way that even if they do have side effects, that they're not all calling out simultaneously. So we did discuss that. We talked about that, and that's why we staggered all of our people. The other thing that we have is that, when you do get the vaccine, we do give them the EUA fact sheet for the recipients of the vaccine, so they're aware and they're familiar with what's going on. And then we also gave them information so that they can download the vSafe app so that they can, report out and do the tracking. And then another thing is that we do have a hotline where they can call in, where, we can guide them and help them. And we have a lot of communication. That's one of the things that we really, really focused on during this entire time frame, even when the pandemic started and now during the vaccination phase of it, is that we have email addresses set up. We have podcasts that happen multiple times a week. Our co-CEOs send out a frequent update in terms of different things. And so people can have different ways of reaching us. They can email us. They can listen to the podcast. They can call in. There's employee health. So there's a lot of different ways, a lot of different channels where we can support them and communicate with them.
Great. Definitely, communication is really critical in this process. And it doesn't happen organically. Our next question comes from Olivia Goldhill. And Olivia, if you could unmute yourself when you are ready, we would love to have your question.
Can you hear me okay?
Yes.
Okay,
And your
great.
affiliation?
Oh, I'm Olivia Goldhill from Stat News. My question is for Ed Coletta. I was wondering, you mentioned, that Walgreens has access to a lot of the country, nearly 80%. Do care home facilities have to be within a certain distance of a Walgreens in order to, work with you to get the vaccine? And if so, what is the distance? Or have you committed to kind of work with any care home facility that would like to work with you?
Thanks, Olivia. So just so I understand your question, are you asking about the long-term care facilities in particular and how many miles?
Yes, exactly.
Right. So I think based on our population, of our store population and where we are around the country, I don't believe we have a hard mileage number in terms of how far, but I think that what the CDC's role is to balance our footprint, the CVS footprint, and then see what other options are available for those long-term care facilities that may not be within a certain reach. But we haven't turned down any long-term facility that has selected us. So if it's more than 50 miles or it's more than 75 miles and they've selected Walgreens, then we would be servicing them.
Okay, are there any, but are there some facilities that basically wouldn't have the, CDC would make the decision, they wouldn't have the option to work with you? Is that what you're saying?
Not based on mileage. I think that there are certain circumstances where a long-term care facility may not have anybody in filling the beds. That's one of the criteria that obviously has to be filled. They're not going to go do a facility that doesn't have any patients. But I'm not aware of any other criteria that CDC has used to not have a facility be able to receive the vaccine as part of the long-term care facility partnership with the pharmacies.
Okay, that's great. Thank you very much.
You're welcome.
Great, thank you. And we had a question from the chat in our chat feature, and this probably goes to Jay. Would you please lead us through the distribution, including information on the boxes and such? Again, you ran through a lot of good information quite quickly. So if you could just take a few minutes and maybe walk us again through that, through the process. And Jay, you may need to make sure that you're unmuted.
That would help, right? Yeah. At a high level, there's I discussed three solutions. There's going to be many, but the three primary solutions are the first shipment that has 1,000 to 5,000 doses. That's built for not just the shipment, but also the storage of the vaccines at facilities like Ed's Walgreens, and that can last up to 20 days. The secondary solutions that will be coming out in the new year are designed to deliver to more remote places, places that really can't use up 1,000 doses even in 20 days. And so they'll receive maybe up to 150 doses. And that's designed to be shipped and last 4 days on dry ice and then be transferred to a refrigerator for another 5 days. Again, just speaking of Pfizer's distribution needs. And then the final one we talked about was the last mile carry case, designed for both Pfizer and Moderna to get to the long-term care facilities on day trips. And all of them have to be not just reliable, but easy to use. We're asking a lot of people to step up and distribute these vaccines at unbelievable speed. And so trying to reduce the amount of confusion and complexity in each of these is obviously critical to making sure they get there safely.
Okay. And we had a few sort of a little more context from that questioner. Are you saying that for the last mile, the Pfizer vaccine can be shipped at a much higher temperature than it is because for those last 4 days that it will last in for that last mile? The Moderna vaccine is shipped frozen, and that the vaccine, if it's shipped concentrated and then diluted with saline solution, where will that be? Where will that? In what situations will that happen?
Well, the Pfizer vaccine can be, again, stored and brought last mile at refrigerated temperatures. So it will last 5 days at the end after you've unthawed it, after you've thawed it. And so the Moderna vaccine, though, should be shipped at -20. But exactly how it's administered at the point of care, I'm going to defer to the other panelists, the experts on this call.
Is there anyone else who would like to?
Sure, this is Claire. I can comment on that. The Pfizer vaccine does get diluted, and the Moderna vaccine does not get diluted. So the Moderna vaccine is just drawn out of the vial, ready to go. The Pfizer vaccine, you draw it, you dilute it, and then you draw it into the syringe to give it. Both vaccines, after they've been drawn, have to be used fairly quickly, have to be used within 6 hours.
Great, thank you.
Yeah, that's correct. That's what we found today too, and that's how we planned our schedule.
Thank you. We have 2 more questions. The first one is from Emily Paulin. If you could please unmute yourself and identify your organization. Emily Paulin.
Hi there. Can you hear me? This is Emily Paulin.
Yes.
I'm from aarp.org. I have a question for Ed. I understand, Ed, that Walgreens can't administer vaccines until they're allocated to Walgreens for long-term care facilities by the state governments. And I know you touched on this on the facility level in a previous question, but on kind of the state level, once they're allocated to Walgreens, how do you guys decide which long-term care facilities are visited first, particularly while the supply is limited? Is that decided by you, or is that decided by the state?
Yeah, great question, Emily. That's something that we've given a lot of attention to and worked very closely with the CDC on. And the CDC's recommendation has been essentially threefold. Number one, ensure that you're hitting populations where the chances for death are the greatest. So that is larger facilities. The second is to ensure that you're hitting medically underserved areas and focusing on those facilities that may be smaller and may not be reached as easily. And then the third criteria is to ensure as little waste as possible. So going back to Jay's comment and others about if you have a Pfizer tray of 997 doses and that has now become room temperature or refrigerated, you need to use that within 5 days. So all of our planning then stacks all 3 of those different factors, which we've worked with the CDC on those factors, and then that is how we overlay which long-term care facilities will be scheduled and coordinated in that order.
Wonderful, thanks, Ed.
Great, thank you. Our next questioner is Brian Grimmett. Brian, if you could unmute yourself and identify your organization.
Yeah, this is Brian Grimmett. I'm a reporter with the Kansas News Service. This is kind of similar to the last question, but I was just wondering if it makes it at all more complicated from a logistics standpoint that every state is going to have a different plan rather than having a singular plan from a federal government on who should get it and when.
Sure. So go ahead, Claire.
Well, I was just going to comment that I think that it makes sense the way that we're doing it, where the vaccine is the inventory, the whole inventory is managed centrally, and it's allocated out to states, and then those states can really work with their own communities about where it goes in the last mile. And I think Walgreens and CVS have that ability to do that too, because they have, you know, a network across the country, and so they're getting an allocation eventually, and they can do that too. But I think it makes sense the way we're doing it, and we're basing it on what we already do with the Vaccines for Children program, having a central distribution plan, but having the states sort of managing where it goes within their state.
Great, thank you very much. I wanted to ask another question about sort of the follow-up, because I'm going through this right now with just my shingles and pneumonia vaccines, and could not tell you when I got it or when I need to go back for my second dose. And we know how critical. Fortunately, we're talking about doing this within a matter of weeks, not months, as we are with these adult vaccines. But what methods can industry stakeholders use to support follow-up for the second dose? I know you've talked a little bit about it, but do you think, apart from getting the piece of paper and the card, will there be text, email reminders, hotlines, portals, EHRs? What will be the mechanism, if anyone is able to answer that question?
Yeah, I can go back to what we did.
Sure.
Again, so we designed it like a round trip ticket. So when you schedule your first dose, you're also simultaneously receiving your second appointment for your second dose. So we start with the Pfizer vaccine, which is 21 days apart. And so that's how we had it. So nobody goes to the airport. Well, some people probably do, but the majority of people don't go to the airport and schedule, a one-way ticket out, and then once they get on the plane, they schedule their trip back in. Most people do it as a round-trip ticket, and that's what we did. And then what we're doing is we're sending email reminders, we're sending text message reminders, and we're sending communication, from our leadership or senior leadership here, and reminding people that, listen, your upcoming appointment's coming up. Make sure you show up on this day, make sure you arrive at the specified time in your appointment so that they have all of the information necessary well before they actually go in. Another point that I want to bring up is that it's very important that the scheduling and the coordination occurs at a great level, because the Pfizer vials, they're multi-dose vials. So there's 5 doses per vial. So you can imagine from a logistical standpoint, when you're scheduling people, let's say there's a no-show, or, somebody else, that there's a little bit of flux, you may have 330 people scheduled that day, which is divisible by 5, but you have 3 no-shows, so you now have to have a waiting list or a hot list, basically. I equate it similar to, hey, be on standby, be ready. We're going to call you if there's other extra doses available today. So we also have that developed.
Okay, thank you.
Kate, I'm happy to speak real quickly. The
you.
long-term care facilities, it's more of a built-in model, obviously. And so the planning will absolutely be dependent on first shot, as I mentioned, in the 3 different phases. For phase 2, as we get into more of the general population, we'll be doing very similar. There's an end-to-end experience where once the patient makes the first appointment, that then triggers in the system to order the allocation from the HHS, CDC Tiberius system that's been built. That then goes and ships, the person shows up, that then triggers a vaccine record, which also then goes into the system so that, for example, if somebody first goes to Walgreens to get a shot and then decides they want to go to an independent or a grocer or what have you, there's the ability to look up in the state registry as well as into the federal government system which shot that individual received, so that they can obviously get the same one for the second dose. And that is, of course, email reminders, text reminders, and in some cases, phone calls if necessary.
Okay. Well, I'm just curious. I mean, at any one of these sites, you're only going to have one vaccine or the other. I wouldn't expect Walgreens to be offering both in store when it gets down to the spring months. Would there be a choice of vaccine?
Probably not. The concern or challenge would be if an individual, went to one pharmacy for the first shot and then didn't recall or remember maybe which, or they said, convenience wise, I want to now go to this pharmacy instead of the one I went to 30 days ago. And they, for whatever reason, don't recall which vaccine they happen to have done the first time. So that's why this very robust network is in place, which again, it's the federal government system connected to the state registries as well.
Yeah. That's great. Thank you.
I just wanted to add, as a backup to the federal system, to the state system, people will also be given a card. So they'll have a little card. They can take a picture of it. If they're not working where Dr. Gandhi is, they're not scheduling both at the same time, they will have something. There are multiple redundant systems in place.
Great. I understand Emily Pollan had a follow-up. Emily of aarp.org. If you could unmute yourself and ask your follow-up question.
Yeah, thanks. This one's for Ed again. I know that it's very hard at the moment to keep up with every single state plan. I know states are allocating to different plans, but I just want to confirm that no long-term care facilities are going to be administered the vaccines before next week. Is that correct? I just ask because I know, for example, in Ohio, they've announced that they're sending a shipment of around 90,000 vaccines to Walgreens and CVS today, I believe it is, for congregate care settings. But will they not kind of embark onto that last mile, as Jay's described it, until next week, or will some go out this week?
So we continue to work really closely with the CDC as well as Operation Warp Speed and the states. I can't speak to definitive date on whether that's going to occur at the end of this week or early next week. What I would tell you is that as we've worked with both OWS and the CDC, there's clearly, I think, been different discussions about when it would be helpful to ensure that the systems are up and running and whether it makes sense to do that on a pre-site or pre-selection basis. But I'm not aware of anything occurring. I know that there's a timeline over the next several days.
Wonderful, thank you.
And I would just add to that states were told that when they wanted to flip the on switch for their program, you know, they have to provide the appropriate number of allocation, and there's a 2-week window. So if they wanted to activate for next week, they had to turn the switch on last week. And folks that are activating it with Moderna, then that will come a week later. The states are activating.
Great, thank you. Our next question comes from Debbie Kaplan. Debbie, if you could unmute yourself and identify your organization.
Yep, I'm unmuted. This is Debbie Kaplan. I'm calling from Supply Chain Dive. This is a 2-part question for Ed, and if anybody else wants to weigh in. The question is about staffing to administer the vaccines, especially for when it gets to the general public. I know when I go into Walgreens for my flu vaccine, it takes me like 20 minutes and there's so much paperwork, and then I have to wait, even though it seems like there's nobody there, for the pharmacist to finish whatever. I mean, there's so much going on, even if there's nobody there. I'm assuming there's going to be a more streamlined system for vaccination. So I was wondering about how staffing is going to work, both for, I guess, for long-term care facilities, and if that's going to take away from what's happening within the pharmacy itself, and also when it gets down to the clinic, when it gets down to the mainstream people like me. And the other part of that question is, I know there have been needle shortages or talks about needle shortages, and given how many vaccines are going to be administered, I wondered if there was any update on if that's an issue.
Sure. Let me take the second question first because it's easier and the answer is quick. We've been planning for months with great companies like Jay's to make sure that we have adequate supply for all types of different things, from ultra cold to the pizza boxes to needles, etc. At this particular moment, we're not concerned about shortages with needles or any other pieces right now. As it relates to your first question, I think there's 2 pieces. One is, what does the customer experience look like in phase 2? And then how will that be impacted by staffing? We kind of look at this as having 3 different pieces to it. We have our current stable of pharmacists as pharmacy techs that are able to administer vaccines over the next couple of weeks in long-term care settings, and then that will transition to the general population. We're able to flex up some of those individuals that are interested in, frankly, taking an additional shift or 2, and that would then have folks be available depending on the store size and everything else to work an additional hour and vaccinate more individuals. In addition to that, though, we are and have announced this, as has CVS, we are looking to add additional pharmacists and pharmacy personnel to help with what we believe will be a much bigger push to vaccinate many more individuals as we get into, you know, the end of the first quarter of next year. What I would tell you is that we have, if you've gone online to the Walgreens app in order to look for a COVID testing site, you answer a number of questions, and then you go on and fill out your demographic information, and then you choose an appointment time. And we're going to be doing similar, just kind of a fancier version of that for vaccines. So we are going to ensure the strictest safety protocols for the vaccine administration, and only a certain number of individuals will be in the store at any given time. Only a certain number of individuals will be able to receive the vaccination through the course of a day. And in addition, because of the app and all that information, it will cut down to almost zero the paperwork that's typically required for a flu shot that you may have experienced. Part of the challenge with a prescription and a flu shot is there's usually back-end adjudication with the payers, either the health insurance company or the PBM, and that's largely a lot of what the paperwork is around, is confirming insurance eligibility and essentially asking the big question, who's paying for this? So a lot of that is taken out of the way, and a lot of that will be filled out on the app for those that are able to do so ahead of time.
Great. I'd just like to ask one final question, one that came in from through the chat. With this rollout, have any logistical challenges come up this week as vaccines have started to go out? Anything that was unforeseen or unexpected? And what was the response, if any? I don't know if you guys are aware of any bumps in the road, so to speak, just yet.
So this is Claire. I mean, I would comment. I haven't heard of any big bumps in the road. The deliveries were tracked. They arrived on time. The ancillary kits arrived on time, seemingly. You know, things are running smoothly with that. There have been, you know, states that are planning in the next week or so, you know, redistributing. There have been, you know, changing recommendations around that over the last week or so. So there's some adjustment made there with how they're doing things. But as far as I've heard, you know, things are running smoothly at this point.
And that is about all we can hope for, I think, as we continue past these first 48 hours. I wanted to ask just all of you, give you an opportunity for some final thoughts if you want to wrap up and as we conclude this session. Thank you. Let's start with Claire. Any final thoughts?
You know, I guess I would just say this is an amazing partnership. I mean, you have multiple people here from different public health, private sector, Walgreens, the hospital. You know, the collaboration is unprecedented for this campaign. There may be some hiccups, but every day that we're vaccinating even one person, you know, we're that much closer to getting out of this pandemic. And it's just, it really is incredible, the effort that's being made and what we're accomplishing.
Great, thank you. Jay?
Yeah, I would just echo Claire's comments. I think the collaboration, the coordination, everybody's got everybody's cell phone numbers, and it's 24/7, and that's okay. I accidentally called one of my customers last night at 10 o'clock by mistake as I'm getting in my car, and they answered the phone. They said, "What can I help you with?" I'm like, "Oh, I'm so sorry." And it's like, "All right, it's all right. That's what we do right now." So it's good. We're all supporting each other, and I'm just you know, thrilled to be a part of it.
Great, thank you. Let's see, Ed, any final thoughts?
I probably wouldn't have gone there, but Jay did. I couldn't agree more. This is a 24/7 effort, and I couldn't be prouder of our 220,000 Walgreens team members that have been on the front lines. Whether you're working the cash register or you're working the pharmacy, they've been doing that since early March. They've been doing it through COVID testing, outside, inside, and now we're going to do it with vaccines. And hopefully it's going to allow us to try to get back to some semblance of normality. But it has been an incredible partnership. Operation Warp Speed, HHS, the states, and the CDC, and all of them have played an incredible role, along with a number of healthcare professionals and private entities.
Great, thank you. And finally, Sneha.
Yeah, I express the same sentiments. You all stole my words, but Jay, don't feel so bad about calling somebody at 10. I call my team members at 3 a.m. to, you know, work out some scheduling case. So, you know, it is a 24/7 operation. I mean, from beginning to finish, we got our schedules and everything up and running in 9 days, which normally would take several months to put online. So, but no, fantastic collaboration with the government, with the state, with the feds. I mean, all around. And we have an incident management team that's staffed every day. And so just very happy, very proud of the effort that everybody put in, including the guidance. Whenever we asked for guidance from different entities, we got it right away. So just really proud to be a part of this.
Great. Well, thank you all for your insights on this incredible topic. I mean, there really isn't anything else to talk about, and the partnerships you all have built. I mean, Sneha, your folks have been on the front line for most of the year. Incredibly grateful to all the frontline healthcare workers and to all of our partners in the months and the weeks to come ahead. I want to thank you for joining us this afternoon. And to our audience, please take the time to complete the brief evaluation survey that you will receive immediately after the broadcast ends, as well as via email later today. Thank you and have a good rest of your day.
Thank you.